and I will let Margaret do all the rest. Take it away.
Thank you, everyone, for coming today. Welcome to this Mass Peace Action event sponsored by Doctors Against Genocide, Pax Christi, Western Massachusetts, Code Pink, Western Massachusetts, Community Alliance for Peace and Justice, Southeastern Massachusetts Coalition for a Free Palestine, River Valley for Gaza Healthcare, Connecticut Palestine Alliance, Healthcare Workers for Palestine, Connecticut, and Demilitarize Western Massachusetts. We're grateful to the Unitarian Society of Northampton and Florence for opening their doors to this event and welcoming free expression of thought. Today, we'll approach our topic of the destruction of healthcare systems geographically, focusing first on Gaza with Dr. Deborah Widener, who will address the mental health situation for healthcare workers and the general population. Next, we'll move outwards to Egypt with Hiba El-Jafarawi, physician assistant, who will discuss the medical evacuee situation there, talk about the nonprofit We Will Return, and talk about family members remaining in Gaza. Finally, moving outwards even further still, to where we stand here in the United States, Dr. Kuemmerle will address the silence within the U.S. healthcare industry to this ongoing genocide. So just housekeeping a little bit. Bathrooms down the hallway here. In terms of our event schedule, we'll follow my part up with the land acknowledgement and speaker bio. We're going to then proceed to 90 minutes of our 3 speakers, 2 in person, 1 remote. Then we'll follow up 30 minutes Q&A, both online and in person. 15 minutes to River Valley for Gaza Healthcare to discuss their projects and successes. We're going to work in healthcare workers for Palestine from Connecticut. And we'll do our final 40 minutes with small group Q&A with here in person with speakers, signing Bread Not Bombs, the petition. We'll do our networking, and of course, we'll do our coffee time. So having said that, I'll turn the mic over to Jean.
Good afternoon. I'm Jean Allen, a family nurse practitioner, a member of both Pax Christi and River Valley for Gaza Healthcare. We want to begin by acknowledging we are gathered on the unceded, unsurrendered, traditional territory of a number of tribes, including the Nipmuc, Pocumtuck, Nonotuck, and Agawam. The impacts of settler colonialism from Turtle Island to Palestine must be acknowledged as the root causes of poor health and social outcomes of indigenous peoples here on the land that we occupy and Palestine. In Palestine, we recognize the continuing Nakba, which began in 1948, as an ongoing process of genocide. Israeli genocidal colonial violence, partnered by the United States, continues to cause unimaginable catastrophic conditions in Gaza, the West Bank, and throughout all of Palestine. So we stand with our indigenous brothers and sisters. And now the main event. Dr. Deborah Widener is a general and child adolescent psychiatrist who transitioned from that role to humanitarian work with her first mission to Gaza in August of 2024. With over 25 years of clinical and leadership experience, thank you. She has led initiatives to reduce suicide deaths, eliminate physical restraints, and integrate behavioral health and primary care treatment. Dr. Widener completed her residency at the University of Pennsylvania, her fellowship at Harvard Children's Hospital, and her MBA at MIT. Now that's a lot of letters for you. But this is Deborah, and I'm really glad to hear from her. Thank you.
Good afternoon. Mic check. Everybody can hear? Okay. I'm sure we'll find out if folks on the Zoom can't hear. I am so honored to be here and talk about my experience. I could talk about it for hours because there's so much to say and so much to share. I took a lot of photographs while I was there as well, and my slide deck is about 14 slides, and I have about one picture per slide, and I probably have a couple hundred pictures. So I tried to pick the ones that were most poignant for the presentation, but I'm happy that we'll have time afterwards to do more questions. Tony Ann, do I advance?
Yes, so yours is this one right here?
Yes, yes,
All right, give me a second. Give me a second. And
Okay, we're going now. We're doing it. I have added this slide to all of my decks and presentations because these are the Gazan people that I worked with in the clinic in Gaza. And without them, I wouldn't have had the experience I had, wouldn't have learned everything that I learned. So this is a combination of psychiatrists, psychiatric nurses, psychologists, and social workers. And just want to make sure I acknowledge them. So just to give you a little bit of context and compare and contrast to the current state today, I was there in August, September 2024. And at the time, so that was about 340 days into the genocide. I think this group is comfortable with me using that word. Okay, so I don't have to say conflict. Yes, so it depends where I'm speaking, what word I have to use. Today, I believe we're at day 589. When I was there, the official, yeah, it seems like the speaker, I mean, it seems like something happened, right? It went down.
speaker went down?
This speaker that I'm,
Good. You speak directly in front of it.
okay, let me move this over. Okay. So the official, oh, that's much better. The official death rate or death toll when I was there was 41,000, which of course we know is a gross underestimate. As of yesterday, it was 52,900, which of course, again, is just a gross estimate. Towards the end of 2024, the Lancet Medical Journal estimated the death numbers at 186,000. So, you know, getting the death numbers is dependent on family members filling out paperwork, basically a form in Gaza to submit to the Palestinian Health Authority. And, you know, so it's a very difficult thing to figure out at the moment. And as you know, there's been a full infrastructure collapse in every way: healthcare, educational, utilities, you know, they call it a scholasticide, and everything. I feel like the sound just went down again. Hello, hello. So I'll just project, and if I hear that it's picked up again, I'll stop shouting.
You should be able to.
Okay, so as far as the takeaways, the theme of this presentation was realities, ramifications, and actions. So I'm going to share with you what I saw as the realities, what I saw as the ramifications, and hopefully we can talk a little bit about your actions, what you can do. So the mission itself. So what happened is I left my position as a vice president for a large healthcare system in Connecticut in almost exactly a year ago in April to pivot from the traditional clinical work to humanitarian work. So when I did that in April 2024, I said, okay, now I'm going to go on a mission. And I started applying to all these NGOs that do medical missions, and nobody responded. or they rejected me because they don't need a psychiatrist. They need surgeons and people who correct cleft palates and fix eyes and, you know, do surgeries and all that kind of thing. So I thought, what have I done? What am I going to do with my life? And then there was a call by the Palestinian American Medical Association, PAMA, because I had signed up for everything. So I got this call for psychiatrists and mental health providers. I thought, oh my gosh, this is my moment. That they were looking for mental health providers to join their EMTs, emergency medical teams. And through a lot of back and forth and a lot of, oh, how many people are going to be on the team? And this is going to be so amazing. It turned out there were 2 of us in the whole planet that signed up for this mission for 4 weeks. People canceled. It's very difficult as a practicing provider to take off for 4 weeks, right? If there was a time that they lowered it to 2 weeks, but then they kept it at 4 weeks. So we, myself and a Jordanian psychiatrist were the 2 psychiatrists that were deployed. We went to Nasser Hospital Complex in Khan Yunis, and our mission was through a collaboration with PAMA, the Palestinian Health Authority, and the World Health Organization to do an assessment of the healthcare workers and decide what kind of support they needed. So we were phase 1, go in, observe, and do an assessment. Oh, gosh, I forgot to advance my slides, sorry. So I just said all of this, but I want to describe the pictures to you. So the picture on the top I took when I was there, Nasser Medical Complex, you can see that. It was a complex, so there were multiple buildings, but this was really the only one functional because the others had been burned or destroyed in some way. The picture at the bottom, I did not take when I was there. I got it off of social media because you can see it's identical, right? You can see it's the same hospital, but this was about a month ago. I don't know how closely people follow. I felt incredibly safe at Nasser Hospital, maybe naively so. I felt that because there were American and British doctors, that we were basically the human shields and that we wouldn't be touched. Yeah, okay. And every day, our coordinates were submitted to COGAT, the security folks of the IOF, and that meant protection. If they knew where you were, they wouldn't bomb you. So I was so really shocked when I heard that Nasser Hospital got bombed. This was about a month and a half or 2, and the missile hit the male surgical unit. And there were a couple of deaths, could have been much, much worse, a couple of deaths and injuries. And this was the fire that was, take a picture of that fire that was happening that night. Now, since that missile a couple months ago, there was just a couple days ago, Nasser Hospital was hit again. So it's, the days of feeling protected, it must be very difficult to be there as a healthcare provider now. Thank you. So let me talk a little bit about the work that that's Dr. Wael in the picture there, the Jordanian psychiatrist. That's the room that we worked in every morning, the psychiatry clinic. I'm putting in air quotes. The second floor of the hospital was all the specialty clinics. So what you experienced when you walked up to the second floor was chaos. Loud chaos. I wanted to capture it so badly, but you can't just walk around with your phone videoing everything. It makes people uncomfortable, and I wish I could have done more of that, but this was a single room that it was probably about a quarter of the size of this space. So I was sitting at a desk next to Dr. Wael, and the opposite Dr. Wael, behind the people standing up, is where the pharmacist sat. And then the brown cabinet that you see there is the medication closet with all the medicine. So you could think of it as a free clinic. Patients would line up in the morning, no appointments. So there were no appointments at any of the specialty clinics. Line up in the morning, wait to be seen. When a medication was prescribed, the pharmacist would go into the cabinet and basically hand them a blister pack. And the what is kind of poignant about this picture is Dr. Wael is on the left and Dr. Arij, who is a Palestinian psychiatrist, is on the right. So you have two doctors sitting next to each other at the same table with two patients across the table, both being seen at the same time. And then if you see the man in the middle with a gray shirt on going like this, so he's not a patient being seen by either Dr. Arij nor Dr. Wael. He's like the next person in line. So this happened all the time where there would be a group of people standing in front of you and you would have to say, and you are? Maybe they were related to the family, but maybe they were just the next person in line. So you'd have to just gently say, do you mind just stepping back? Because the push to get into the door and the tension in the hallway sometimes escalated to the point where we had to really ask people to stand outside and close the door. We hated to do that because it was so hot. This was August and it was incredibly hot. But so as far as privacy, there isn't any. So Dr. Wael is interviewing a patient, Dr. Arij is interviewing a patient. Each patient gets maybe a minute or two. If it's a new evaluation, maybe you'll get 5 minutes. And you are 100% dependent on the patient's story. They're the historian. They're giving you the information. There's no electronic medical record anymore, no electronic prescribing system to look at the medicines and what change did the doctor make the last time they were here. In the month that I was there, we saw 1,000 patients between 9:30 and 1 p.m., more like 10 to 1 p.m. So the pace was extremely fast. And the bottom picture there is actually two different pictures. So the picture at the bottom is what a prescription looked like, which, whoops. That one. So the picture at the bottom is a piece of paper. Basically, the registration desk outside on the second floor would rip up paper into 4 pieces and write the patient's name at the top and the date, and the patient came in with their piece of paper, and then we would write the what we were prescribing. And then so you see the man with the white shirt sitting down has, thank you. So the man in the middle with the white shirt has his piece of paper in his hand. So he's got his prescription. So he's going to literally turn around and hand it to the pharmacist, who will give them a blister pack. We could only give medicine for about 10 days because this was really the ultimate public health effort, and you can't give one person all the medicine that's in the cabinet. We were asked by the World Health Organization to track diagnoses. So this is in no particular order. This is the diagnoses that they asked us to track. We could have tracked a whole bunch of things. And you'll notice there's a very high bar in the middle, which is psychotic illnesses as far as diagnoses. And there's a very, very low bar for PTSD, which might surprise people. And I usually engage with folks to ask, what do you make of that? Why do you think the psychotic disorders is so high? And why do you think the PTSD, which is post-traumatic stress disorder, why do you think that's so low? So the person said there's no post to the trauma, it's ongoing. Excellent point. Any other thoughts? It's always been there. What about the psychotic illnesses? Any thoughts about why that's so high? Yeah. So the person in the audience said that what the experience of the population could drive people to be psychotic. And that absolutely did happen. There were notable cases of like a youth or maybe a 21-year-old. I still remember because we saw him multiple times over the course of the month. He was mute. He was so traumatized by an explosion at the house or in the building that he couldn't speak. He just couldn't, and you could just tell he was there, but he was extremely traumatized. So that is absolutely one possibility. I think that my professional opinion is that if you're anxious and you're depressed and you're in a war, everybody is anxious and depressed. But if you're psychotic, you kind of don't have a choice but to get treatment. Everybody's living in tents on top of each other. And if you become psychotic or you're having command hallucinations, you have to think of everything as a communal approach, a communal environment. Yeah, it keeps going out, in and out for some reason. So that's just my opinion. I'm sure it's multifactorial and there's a lot of reasons. Next slide, please. So a moment about the medication. I talked to you about the medication closet, which had probably 25 different psychiatric medicines in it. So people who are not in the business, that's not very many. There's a lot of psychiatric medication. I mean, antidepressants alone, there's probably 20 to 25 antidepressants in different forms. So you have to use what's in the closet. And there were always drug shortages, which meant that we had to change the medicine. If you came in on drug A for your psychotic illness and we didn't have drug A, I'm very sorry. Mish Matawaf. Anybody here speak Arabic? Mish Matawaf. It means not. You probably say it better. It means not available. So, that was something that I learned. I would just feel so bad. I'd have to say Mish Matawaf. Badil, alternative. I'm sorry, I don't have that one, but I can give you this one. There was one point where we had one antipsychotic. So every single person that came in with a psychotic illness got that one antipsychotic. It was, just nothing that you would ever do in a practice in any other environment, switching fast or using more than one antipsychotic, which we do that, but, it's just a very unusual situation, which meant that because the times that we only had one antipsychotic, it was an antipsychotic that isn't known for being the best antipsychotic. So of all the ones that we were left with, unfortunately, we were left with one that could be sedating and could help with anxiety, but it actually wasn't the best when it comes to psychosis. So we saw people relapsing and destabilizing while we were there. And I can remember a man, because of that privacy issue, I could remember a man like leaning into me, almost whispering, saying, I'm going to hit somebody. You have to get me this medicine, the one that helps him. And it just, it was it was so difficult. It was so difficult. So I really couldn't tolerate that. So I went through different phases in my 30 days, and I have a picture here of a pharmacy. So in the encampment, there are merchants and there are pharmacies, and this is a picture of a pharmacy, and there's many of these in the encampment. This woman happens to be the sister of the medical director that we worked with through the Palestinian American Medical Association. So that was nice that we got to meet her. But we started in the clinic, we started to buy antipsychotic injections from these little pharmacies in the encampment because of the destabilization that we were seeing. And the people that I worked with knew the patients. I mean, they knew them very well. And somebody would come in, we didn't have the medicine. but we had bought it from one of these little merchants and it was in the drawer. And maybe we would have 4 vials and we would have to decide that day who's going to get those 4 vials. And we did that for a little while. And then we stopped doing it, because it's just one moral dilemma after another. Because then I started thinking, well, if I'm buying all the Haldol from this woman, this pharmacist, and somebody in the encampment is relying on her for their medicine, now they're going to show up for their medicine, but Dr. Widener bought it all and she's giving it to somebody else, So we stopped doing that. And this was a nut I could not crack while I was there, because in my role as a quality and safety executive, my job was to fix problems like this. Where do you get the medicine from? How do you order it? How do you get the right medicines on the list? I couldn't figure it out in the 30 days that I was there. We would get shipments of boxes and we didn't know what we were getting. It was always a great day to get the boxes because what did we get? Let's put the medication on the shelf. But you really never knew what you were going to get. Next slide, please. As far as the mission that we were there for, which was assessing the healthcare workers that were there, let me talk a little bit about, healthcare worker, I just abbreviated that to HCW. So I'm just going to jump right over to the pictures to tell the stories. So the picture at the bottom is the bottom bed of a bunk bed. I know it's not the best picture, but that was my bed in the on-call room, just off the intensive care unit. And it was perfectly comfortable. There were maybe 1, 2, 3, 4, 5 sets of bunk beds in the women's room. And then on the opposite side was a room for the men and their bunk beds. So perfectly comfortable. What was very difficult was the Gazan doctors were not comfortable in these rooms. It was the foreign doctors that got to stay in these rooms. The local doctors were on the dirt in the street and in tents. So that just, you just felt it felt awful. So just off the ICU on call room, the middle picture is the terrace off of the intensive care unit on call room. And those are mattresses because many of the local doctors or nurses, et cetera, administrators even would sleep on those mattresses on the terrace, while we were in the bunk beds. And then the top picture is an example of a very, very, difficult to look at tent. So, I'm walking upstairs to the ICU on-call room to sleep, but the people that I work with are leaving the hospital, getting on the bus, getting dropped off in the encampment, and sleeping in an environment like this. This picture is particularly bad because after very windy or rainy nights, if you had one little tear in your tent, it just ripped up, it just got ripped to shreds. So, we felt a lot of guilt, a lot of hopelessness. There was a doctor a surgeon that was there, basically overlapped the same time I did, who was kind of prickly, kind of irritable, prickly, not through PAMA, through another organization. And I remember he would get the folks from his NGO and sit them down and complain. Oh, this is happening. That in the OR, they're doing this and they're not giving me that. And they're not calling me. It was just always. And sometimes I would try to offer food. Give some of my food. Maybe that would help. This was a foreign doctor, not a local doctor. A foreign doctor there on a mission. And maybe a couple of months after I left, I saw this foreign doctor on a video that had gone viral, where he was giving testimony in his country about his experience, and he cried during his testimony. He at one point he couldn't speak, and I thought, shame on you, Dr. Widener. This surgeon was traumatized. Like, it wasn't a delayed trauma. This was an in-the-moment trauma. And yeah, I feel bad that I didn't pick up on that and didn't offer him more support because he clearly, really struggled. And that's what it was all about. Were the Gazans, all on the other hand, incredibly exhausted and incredibly traumatized, but very grounded in their faith. And you've probably seen a lot of the videos, I'm not sure, where, somebody can be martyred and the family is still saying Alhamdulillah, which is thanks to God. It's just incredible. I can't even put it into words. We did, as far as our interviews of the local healthcare workers, we did see gender differences, whereas there was a stigma to getting mental health, believe it or not, just like in many other places. Although women were much more receptive and said, if you set up the group, just tell a group therapy, just tell us when and where, and we'll be there. Whereas men, docs, it was more like, they wanted to hide in some room off the hospital and do your therapy, which was good for Dr. Wael, who was a smoker, because he would just sit and smoke and sit on the steps and chat. And it was a great way to get to know people. Next slide, please. These are some snippets. So my interviews of the healthcare workers was to ask them 4 or 5 questions, like, tell me your experience with the war, how did you cope, things like that. So these are some snippets that I'll just talk to you about a little bit. I won't read all through them. You can read some of them. But the ones that really stand out to me were, we'll cry when the war is over. So no, there's no space for feeling or crying. Like that's just they just don't do that. And the other reason that they don't do that is because there's no space to do it. And the different people would say, I used to go into this room over here in the hospital and just sit on my own and maybe shed a tear. But there was no more space like that. I mean, there were people living in the hospital. Every space was used for patients, for medical students, for volunteers. So no space. Okay, well, maybe when I go home, I can cry there. No, not really. You're in an encampment and there might be 5, 10 other people sleeping with you in your tent and with your family. So no space to grieve, no space to emote. There were also extremely difficult decisions being made all the time by junior doctors who were exhausted. There has to be a triage system. And if somebody came in a certain state, you basically had to make the decision that keep them comfortable. But it's a whole different threshold than what it would be here, right? Here you would try to save just about anything, whereas there you had to, I don't want to get too graphic about it, but you would just have to, it's a much lower bar. So I'll just do a time check. I mean, so that means I have how much time? Okay, great. I can do that. So as far as what worked as a mental health worker or psychiatric clinician is being very, I got a huge culture lesson, right, immediately. So having some humility as far as their experience, not talking about food, not talking about everything you have. Although they're so interested. I mean, the Gazan people, Palestinian people are the kindest, most embracing people. Myself and a medical student, Sister Sarah, we would often walk off the grounds of the complex and go get fruit or cookies or things like that. And they would say to me, don't go out there, Dr. Deborah, it's not safe. I'll go get the cookies for you. I'd say, well, it's not safe for you either. Yeah, but it's not safe. You shouldn't go. I'll go get the cookies. And when I left my mission, so many local Gazans would say, please let me know when your plane lands. Just let me know that you're okay. And I just, they were so worried about me, and it just was something I wasn't expecting. But the narrative of the stories that they told me, I also wasn't expecting. And I took copious notes and, hope to be able to put that together in some other kind of way sometime. And the other thing I really learned a lot about is how integrated religion is, of course, in everything. Suffering, someone being killed, having patience, these are the psychological anchors for the people of Palestine. So the Western model that I had been trained in and raised in, it doesn't apply. It doesn't apply for many reasons, which I will run through quickly. If you went to a therapist here, 99 out of 100 times it's going to be one-on-one therapy, right? Whereas in Palestine, that is really misaligned with what we refer to as collective trauma, or the trauma that everybody's experiencing. Any treatment you have here, a therapist will probably say, this is a safe space, right? Don't we say that it's a safe space? Well, there's no safe space emotionally or literally to do treatment there, but they still do it. And if you think about post-traumatic stress disorder, it assumes pathology, whereas any one of us that is living in the situation that they're living in, we would be experiencing the same thing, right? And in just many of the protocols that we use for trauma, it's difficult to apply them for folks that are going through an active genocide. So I don't think I spoke about the picture. What was the picture in the slide before? Yes. So just more pictures of the clinic and the lack of privacy. This is really just, this Dr. Yasser that is handing over some medicine. And the picture at the bottom, the person with a blue shirt and a vest. So that's somebody wearing a hospital vest. So something that I wasn't expecting, and again, you would never practice this way here, is so many people that we gave medication to were not the actual patient. Other people would come in on behalf of the patient. Sometimes people would come in with 4 slips. We talked about the little slips. Well, this was for my father, this was for my mother, this was for my uncle, and this was for my brother. And these are the medicines I need for each of them. Because sometimes a family member couldn't walk the distance to get to the clinic, or maybe they were too impaired. So there were different situations. The picture on the right was, I captured the thermal balloons of the F-19 started flying over while I was there. So that was like a new moment of new artillery. And these are thermal balloons that would then drop into encampments and catch on fire. As far as sounds, obviously an F-19 is a very, there's an F-19 flying overhead. But we became, maybe me not so much, but I learned from the Gazans all the different sounds. This is what tank fire sounds like. This is what sniper fire sounds like. This is what helicopter fire sounds like. So unfortunately, you learned what all these different bomb sounds were. And they could be way off in the distance and still shake the core of the hospital. The first night I was there, I literally sat up in the bed multiple times because of bombs, only to find out that they were kilometers away. But that's how powerful they were. But there were 2 times while I was there that I actually heard the missile coming in, and that freaked me out. I was making my bed, tried to keep my routine, tried to make my bed every day. And while I was making my bed, I heard the that was the first time I was really scared. And then another time, a couple of days later, outside the hospital, on our way out to get some cookies, I heard another one, and I literally did like like one of these, duck and cover things. And the Dr. Arij was with me, and she wasn't phased. She wasn't phased at all. But it's as far as what kind of support is being offered now, there's actually a lot of different kinds of support. There's the Gaza Community Mental Health Program, which is partly in Gaza, but people all around the world who are doing tele services or providing services for people in Gaza. And Healing for Gaza is another really excellent. They train people first, including training interpreters so you don't have to speak Arabic in order to participate. So it's another really, really excellent one. I do want you to know that there is treatment that's happening. It's just been, of course, very, very difficult because of the multiple displacements that keep occurring. So just yesterday, there's a couple of videos in here. So the upper right, so as you know, the humanitarian aid, we're like 60 days into no food and humanitarian aid getting in to Gaza. And like Heb has her family there, and I have just dear loved ones that I met while I was there who have no food. And through some network, I just found out a week or so ago that we could get a box of that food in the upper right corner to a couple through my dear friend, Sister Gihad, who helped get food to a couple of people that, I met while I was there and have become just like family to me. And the picture at the bottom is the cooked macaroni that this Sister Sarah was able to feed her. She's one of 10 children, and then her mother and father and grandfather. Tony Ann, are we able to play the video on the left? Okay, that's too bad. Because I wanted you to hear the drone sound in both of these videos. It is striking how loud the drones are, and they're constant. When I was there, they were mostly at night, and it used to make me so angry that they chose to use really loud drones at 2 or 3 o'clock in the morning. But these videos are daytime, and these videos are from 2 days ago, and it sounds like the drones are 20 feet above you. It's really disturbing. Can I go to my next slide?
You have permission to play that.
That's okay. Then, so just a moment about the photo. And this is the end, okay? So this photo I took, there's no patient transportation services and somebody who, no, you can't push yourself in a wheelchair. I have to push you in the wheelchair. You know how you go to the hospital and they want to do everything. Or somebody's bringing the blood vials here to there, or the person who's drawing blood comes to you. There's none of that. It's a patient-driven. It has to be patient-driven. You're seen in the emergency room. The family brings you up to X-ray, and there's no behind the curtain X-ray, behind the I don't want to get radiated screen. Everybody's just standing there. When you get your click, 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 and then they wheel you back into the emergency department. And then your family wheels you up to the second floor to get your blood drawn. You wait for the results on a piece of paper, and then the family walks it back down to the emergency room and gives them the piece of paper. And just nothing is the way you would expect it to be. And this picture is kind of speaks to that. This is a girl who is getting some kinds of an IV drip. Could be for dehydration, could be a medicine. And her father is literally walking around with her carrying the bag, because there's no IV poles, there's nothing like that. There's barely a bed. So, in conclusion, I hope that I've given you just a tiny glimpse into what it is like to be there, what it's like from a psychiatrist perspective, and what the psychological effects are for the people that are there. And as far as how you can help, you're here. So thank you very much for being here. Everybody's journey and how they take action is different. And I appreciate that. And just want to remind you to take care of yourselves as you're witnessing everything that's happening and feeling so helpless. Because of the connections that I made while I was there, I've been able to send a lot of money. So if that is something that you are interested in, you could certainly contact me. And I'll just leave. If you want to take a picture with your phone or something, we could certainly talk later about making a donation. And I just put this picture here. This is my last comment. This is a little plastic flowers in a little plastic vase. It's about this high, and it's on my bookshelf now, because when I left, the people of Gaza have nothing and everything is destroyed, but you can't imagine the gifts that I was given. And this was one of them. Dr. Huda, one of the women's psychiatrists, gave me this, and she said, I know it's not much, but I just wanted you to have it. And I mean, these are little things that I will treasure. And and I was talking to Dr. John, because we were all Dr. first name over there, Dr. Deborah, Dr. John. And I was explaining that, my mission was in August, September 2024, and I was supposed to go back in February, just a couple of months ago, but I was canceled. Everybody pray that I can go back. And obviously, much, much, much more important than that is that we have a ceasefire, right? And that the war ends. Thank you.
Thank you, Deborah, for your witness and for sharing it with us. Next, we have Heba? Heba?
Yeah.
Sorry.
No way.
Elja Farawahi. And that I messed that one up too. See, it's not Spanish, so
No
it doesn't come easily to my tongue. But she is a physician assistant and a founding member of the nonprofit organization We Will Return. She graduated from the University of St. Joseph with a master's degree in physician assistant studies and completed her undergrad studies at the University of Hartford with a BS in health sciences. She has 3 years of experience in urgent care and 1.5 years experience in pulmonary and critical care in Connecticut. Her medical mission experience was in 2023 in Turkey through International Medical Relief, providing medical assistance to those who were affected by the earthquake. And she's recently returned from Egypt with We Will Return to assist Gazans who were injured and affected by the ongoing genocide. With family members in Gaza, she aims to help those affected by recent events and work towards providing humanitarian aid and medical assistance. Look forward to hearing you.
Thank you so much. I mean, it's going to be very hard to follow up with Dr. Weiner's presentation, but I'll try. Fair warning, I'm not that great at presenting, so bear with me, please.
Can everybody on Zoom? Ooh. Can everybody on Zoom here see the presentation?
Yes, very good.
All right, amazing.
All right, so let's begin. Everyone can hear me, correct? Okay,
Yes.
good. So, my name is Hebel Jafarawi. I'm a PA, also an executive member of We Will Return. So, just a little bit about our nonprofit organization. So, We Will Return formerly was What's an Inc., was founded in 2020. We're a nonprofit organization, and our goal is to help Palestinians across the world, pretty much wherever there is help needed. Three pillars that we focus on is humanitarian aid, social activism, and education. I don't know if you guys attend a lot of the protests, but we're always frontline and center in those protests as well. Big point that I like to tell everyone is that we don't have any manager fees. So everyone that's on the team is a volunteer. And just a side note, everyone that went on the trip to Egypt was full self-funded. So we paid for our own airfares, our own hotel expenses, food expenses. So why did we end up going to Egypt? Well, for a while, we were having trouble getting a lot of things into Gaza. In the beginning, we were able to send in food trucks, water, and some supplies, but all that had stopped, as you guys all know. We didn't want to just be sitting ducks and waiting for an opportunity to come to us. So we wanted to take initiative. One of the board of directors had mentioned going on a fact-finding mission. We liked the idea. We booked a flight after a few weeks and head off to Egypt. So we also do have connections in Egypt that are currently helping people transition from Gaza to Egypt. And as an organization, we didn't want to just hand over the donations without really knowing where they're going. So we wanted to see firsthand what was actually needed, if there are other ways that we can help other than medical. Okay. So we knew going in that majority of our time was going to be spent at hospitals and clinics. We didn't really have a plan. Again, fact-finding mission. We're going to see what's needed. It was honestly one of the most eye-opening experiences. I really didn't know how they were going to perceive us. Were they going to look at us, hey, the U.S. is one of the biggest supporters to Israel. So it's it's helping with all the destruction that's currently happening. So is there going to be some hostility towards us, pointing fingers, say, hey, it's your country that's doing this? Again, so we didn't have a plan. We didn't want to just send over all this money that we had collected through our galas and things like that, or these little fundraisers that we hold. So another big question that kept going through my mind was, how are we going to really help these people? Are we going to help them medically? Are we going to help them, with their daily lives, providing them with clothes and food and shelter? All right, so just a little bit of background information, just to paint a better picture of what's going on. Unfortunately, the numbers are, I tried to use ChatGPT, but I'm not really a big fan of it. But in terms of numbers, everything is always skewed. Not everything is always delivered in an honest way. So the numbers I got were about 100,000 Palestinians left as of January 2025. I think I recently read an article, it's now up to 115,000. This number was from the Palestinian embassy in Egypt. Of course, for Gazans that leave, they have to pay in order to leave. And typically, things that they would do, sell things that they own, sell their gold in order to be able to get themselves out of that situation. So adults typically anywhere from $5,000 to $12,000 per adult. Children anywhere from $2,500 to up to $7,000. So, okay, you just spent your whole entire life savings, and now you're out of that disaster zone and you're in Egypt. Well, how are you going to survive? You barely have any money. You can only get so much aid from people. So that was a big thing that we were seeing amongst a lot of families that were in Egypt. The Egyptian government was providing assistance to patients, and they were doing great. They're doing a great job. They can only do what they can. So the only issue is that they're under constant and strict surveillance. They were only granted a 35-day visa. After that, it's kind of like they're illegal there, but where else are they going to go? They can't go back to their own country. They can't leave the country. They can't leave Egypt. They're not allowed to work. So people that can work have to have a residency permit, and you can't get that as a refugee. So ended up a lot of people end up going under the table and working to try to provide for their families. Even students, they really couldn't go into school. So a lot of students would do their work online. And if you could attend school, it's not without a high cost. So pay ridiculous amounts of money to get their child into school. Again, they don't have that money. Palestinian embassy did help a lot of Palestinians, and their funding is not that much, but whatever they had, they would try to assist the patients that needed medical attention, critical cases. All right, so prior to going, we knew that prosthetic limbs was going to be one of our major projects and that we wanted to focus on. So as soon as we landed, we dropped off our bags at the apartment and set off to look at the different prosthetic companies. So there were 3 companies that we were looking at. 2 of the major companies were AutoCare and Motion Prosthetic Solutions. The third one was Hand in Hand, which was a nonprofit Egyptian organization. It was a smaller facility, a smaller company, probably not equipped to take on the amount of cases that we had seen and heard of. So we wanted to align ourselves with a company that was able to fulfill our mission and have wanted the same results as we did. So we were shown different types of prosthetics. We were shown above the knee, below the knee, foot, hand, arm at and below the shoulder joint. Discuss the process of receiving a prosthetic, as well as how they as a company would support them after they got their prosthetics. And this is just a little flyer from one of the companies that we saw. It's all in Arabic. I can't read Arabic, but I can speak it. So here are the different types of metals that go into the prosthetic devices. We were able to see and compare the different types of metals, titanium versus steel, discuss different price points. No 2 people are ever the same. So one prosthetic is not going to be the same for one person versus another. So depending on what they want to get out of the prosthetic. So ultimately, we ended up going with the company AutoCare. Now, as a team, we didn't want to just provide a prosthetic limb and call it a day. We wanted a facility, like I said before, to be able to sit with them and provide them well-rounded care. If they have any adjustments that need to be done, for them to actually take initiative and help out with that. So essentially, are they mentally able and stable to handle a prosthetic? It's not that easy. You just lost a limb. So it's not like changing a car part. This is something that you have to live with for the rest of your life. Lifestyle, a prosthetic for a 65-year-old is not going to be the same for a prosthetic for a 25-year-old. You want to think of range of motion, daily activities, expectation, what they have to be mentally aware that this is a prosthetic limb. It's a limb, it's going to be a part of you, but it's not going to be like the one that you had before, that real leg or that real arm that you had before. Fitting and measurements, each patient would get a plaster mold fitting to ensure that the prosthetic fit perfectly. Production turnaround time was about a week to get the prosthetic prepared, which I was really impressed. Honestly, I thought it would take a month. But no, they were pretty quick with it. And it's good quality. So they get all their products from Germany. So we were also looking at quality as well. So the main reason why we didn't go with the nonprofit Egyptian organization was that it was all Egyptian made. The prosthetics didn't last that long. So about a year or two and they'd get worn out. These ones last about 10 years or so. So, and then 12 weeks of PT, that's one of the biggest selling points for me. I want to make sure that the patient is comfortable, able to use a prosthetic correctly, and doesn't have any difficulty with it. So they follow something called a 7-step method. It's all written in Arabic here, but I translated it. So step 1 is general assessment and determining suitable prostheses. Step 2 is prosthetic training. Step 3 is taking measurements. Step 4, trying on the prostheses and making any necessary adjustments. Step 5, the prosthetic use. Step 6, delivery of the prosthesis in its final form. And then step 7 is the follow-up in PT. So while we were there, we took on 4 cases, 2 above the knee amputations, 1 foot amputation, and a prosthetic, 1 arm amputation. So this patient right here is Sundus. So she's 24 years old, has a right above the knee amputation. This was actually her 2nd prosthetic. So when she left Gaza, she ended up going to Turkey. She had someone that was willing to donate or support or provide her the money that she needed for a prosthetic limb. Unfortunately, she really had a bad experience while she was there. The limb that she received was too heavy, painful, and lacked the range of motion that she wanted. She's 24. She wants to be able to move and do things and tie her shoe and things like that. So that experience left her devastated and depressed. She just wanted a sense of normalcy. So at first, she was completely against the idea of getting a prosthetic limb. 100% no, shut the door in our face. But the company that we went with, AutoCare, they, after a little bit of convincing and showing her the prosthetic and, you know, hey, we'll go at your own pace, she ended up agreeing, and I'm very happy. She's very happy with the prosthetic now. So this is her getting fitted for the prosthetic. And then this is Abdullah, who is 21 years old, also above the knee amputation. He's also getting fitted for a prosthetic as well. And here you can see the plaster moldings that's going to be used to help create that personalized prosthetic. And here, so this is Maysoon. So her story is actually sad as well. They're all sad, of course, but she was originally promised. So she has a left arm amputation. She was originally seen by another nonprofit organization about 4 months prior to us going there. They had promised her, hey, we're going to get you a prosthetic. Don't worry, everything is going to be fine. She was waiting for 4 months, lost all hope, and just was very depressed. So guy in the picture looks angry, but I swear he's a sweetheart. He's my uncle. So we all decided right then and there that, hey, we are going to help her and get her a prosthetic. So at first, she did not believe us at all. The AutoCare team the following day went to the hospital, got her measurements, asked, did a mental evaluation to see what she wanted from the prosthetic. So we were really happy that she actually trusted us after that. All right. And then some other projects that we did while we were in Egypt. Like I said, our main focus was the prosthetics project, but we wanted to see what else we can help with. Again, fact-finding mission. So we ended up helping with prosthetic glass eyes. We had 4 patients that we were able to help. There was a girl that they thought she needed a prosthetic eye, but actually needed a retinal surgery to help correct her retinal detachment. We did treatments and payments for cancer patients, for biologics for UC and Crohn's, some little procedures here and there. This was actually some of the recipients, and I don't know if you guys noticed, but Sundus was actually one of the recipients of the prosthetic glass eye as well. All right. And so we did encounter a lot of cancer patients. And for me, it was surprising at first. A lot of the cases that we were seeing were osteosarcoma, blood disorders, breast and colon cancers as well. Like I said, at first I was really surprised, but then after I took a step back and was actually thinking about it, yeah, it kind of does make sense. They were exposed to all these toxins, chemicals, fumes from the bombs, and explosives. So all that leaches into that soil. It's not just, one or two, it's thousands and thousands of bombs that, over time destroys the land. So they're growing their food in that land. It's getting in their water supply. So yeah, just no one really thinks about the aftermath. And this is one of the things that kind of hit me a little hard. So here, this is one of the hospitals that we visited. So you can see the living conditions. Everyone is pretty much living in, yes, it's the size of this room, but you have maybe 6 or 7 families that are living in this space. Each one has 2 or 3 kids. There's no privacy, like Dr. Widener was saying, that even in the hospital, everyone's crammed in here. And these patients have been there for about 6, 7 months living in the hospital. So we went around to a couple of different hospitals, total 6 hospitals. If we were able to give them, pocket money, depending on the rules and regulations of the hospitals. Some places were hard to get in and to be able to give them money. Everything has to be approved and whatnot. But for some of the hospitals that we were allowed to, we went in and visited the patients. Sometimes that alone would just make them so happy, knowing that we're there and we're with them and we're trying to do everything that we can. We're there to assess the situation. So that fear that I had from before, how would they perceive us? That kind of all went away. I started to get teary-eyed. I'm like, these are my people. These are my family. I'm pretty sure my uncle knows you some back home. So, like I said, 6 major hospitals that we visited. 3 of them that were housing the most Palestinians were مستشفى المطرية, مستشفى منيا القمح, and National Hepatology and Tropical Medicine Research Institute. The National Hepatology was actually housing a lot of children, a lot of them with hepatitis A and E, severe dehydration, things like that. So we got to talk with the little ones and they were really cute. And I don't know if you guys know about this about Palestinians, but they really value education. No matter where they are, it's just this little girl, I really gave her props because she's on her bed, studying away. Even if they were sick, she's still studying. Since Gazans are not allowed to attend school in Egypt, a lot of them were on their laptops or tablet watching an online course or connecting to a professor or teacher that's in the West Bank. So that's, they needed internet in order to do all that. So we were able to provide, I think, a couple of hospitals with a couple of months worth of internet to help have the students continue studying. And then just a couple more pictures. This little guy over here is 1 year old, and he's adorable. He had so he actually came over with his grandmother. His mom and dad are still in Gaza. They were not able to travel with them. But he needed emergency heart surgery, I think at age 6 months, or sorry, not 6 months, 9 months. So he's been in the hospital for about 3 months with his grandmother. And she is a 14-year-old girl. Her dad is still in Gaza. She actually needed a kidney transplant. The only person that is able to give her that kidney is her father. So they spent a lot of months back and forth trying to get him over. Last I remember, it's hard to keep track of everyone, but last I remember that he did make it over and was able to successfully do the procedure. So it's the little wins. And here these kids wanted to take so many pictures, so I had to include them in the presentation. But they're like a little mafia gang. But I don't know if you guys can see those buildings in the back. So those are actually housings just strictly for Gazans. There is 24-hour surveillance on them. I tried to go up and actually, give them a little bit pocket money for each family. Did not allow me to do that at all. So I had to fake a little bit of crocodile tears to get me through. Still didn't work, unfortunately, but anyone that wants to go in and out, write your name. It has to get approved by the Egyptian government. That can take days. If they're okay with it, you can go in and give them, but it typically takes about 2 to 3 weeks for that approval. So we were only there for 10 days. So unfortunately, I wasn't able to go upstairs, but we were having people come out and we were able to give them some pocket money. So. And honestly, this is one of my favorite stories. So this little girl, her name is Ahid. She's 7 years old. Her and her sister and mom were able to leave Gaza, but she unfortunately sustained crush injuries on both of her hands, resulting in just three fingers in each hand. She also suffered from some abdominal injuries due to shrapnel. There was another nonprofit organization that was taking care of her. So she's in this picture, she's fine. She's healed almost. You can see the cast on her arm, but the fact that she's still smiling, she's still laughing, she's still interacting. She's shy, but you can see that little glimmer of hope in her eye. And then this is my family. So about 13 family members were able to cross over the border back in May 2024. So this was also a big motivation of why I went to Egypt as well, to get to see them. But yeah, that's all of them. The little one right over here, I don't know if you can see her. Her name is Sara. She's really cute. She just learned how to walk. So, but typically it was around $5,000 per person to get them out at that time. Now it's a lot higher. They went through a group called Yahala. Not sure if they're still active now, but yeah. And so for more information about We Will Return, you can always follow us on Instagram, We Will Return PSC, or we will return.org for any donations. But thank you guys so much for coming and attending.
Thank you. The work goes on in so many places and continues out and out and out. And our next speaker, who we will see on the screen, is going to talk to us about that. Dr. Karameh Kuemmerle, and I probably butchered that name as well, is a pediatric neurologist and epileptologist in Boston. Her clinical work focuses on epilepsy, brain injury, and neurodevelopmental care for children in complex settings. She is the co-founder of Doctors Against Genocide and a leader in Health for Palestine, where she works to advance health equity, community-based care, and justice-driven medicine in refugee camps and conflict-affected areas. Dr. Kuemmerle is a committed advocate for the rights of marginalized patients and healthcare workers, and her work bridges medicine, human rights, and global solidarity. And hi.
Thank you so much, Margaret, and thank you, everyone. Thank you for MAPA and for all the sponsors of this talk and the previous speakers, Dr. Deidre and Heba. I really appreciate your work. It's it's very touching and very difficult times that you have endured with the people in Gaza. It is.
Wait, can you speak again? We're just going to see to test your voice over the Zoom.
Oh, okay. So
Voice is fine.
no one heard what I said before?
No, we heard you.
Okay, so I'll say it again.
No? We just need to do a little bit of testing to see where.
Okay. So
Zoom can hear her, right?
can you hear me?
Can you hear through Zoom?
I cannot hear you very well.
Can you hear through? Can you hear me now?
Yes.
Okay, and then you can hear her through Zoom? All right,
Yes.
so it's
Yes.
just a live audience that needs to be heard, right?
Okay.
Right. Just give me a second. I think I know what's up.
Let me know when you want me to start.
Thank you all for putting through these technical difficulties. Can you try speaking a little bit?
Go on.
Anything? No. Let me see what else. Yeah, the take 5 for just a second while we fix what's going on for the live. Because if you can hear on Zoom, that's great. We're just trying to figure out what's happening through Zoom. We're gonna try to figure out what's happening through live.
If you have a link to this, maybe if you just put it on, we can listen.
No, the TV speakers there. Let me see what's happening.
Right. Yes, can you hear me? Oh. I'm unmuted and
Another option might be to call one of us and get the broadcast that through.
Live and here.
let me know when you want me to speak. To just keep talking so you can test. I'm on the phone with Mirat. Okay.
Yes, when you were able to go in,
I'm also gonna call Cole and see if.
It is, it's just because I'm connected to my phone.
Yeah, we're gonna get this figured out.
Okay. Yeah, people on the Zoom can all hear, but it sounds like people who are in person cannot hear.
Any insight into what's happening?
Yeah, we're going. Yeah, so
Do you know
Zoom
the
can hear her
Wi-Fi
perfectly
here?
fine.
Yes, there is Wi-Fi.
I'm gonna turn you over to.
Yeah, hi. Zoom can hear, her, right? Yeah. Yeah, Zoom can hear correctly, the live. So, but he's. Oh, how's going in?
And then we'll do, what you suggested, it was already. So we'll do it.
Try, so try speaking.
Okay. Can you hear me?
Okay, yeah.
From the
Okay.
from the Zoom or from your phone, Mirat?
Echo, there's an echo, but we can hear you through this Zoom.
The Zoom. Okay, so I can hang up with you.
There's a bit of an echo right now, so we're just trying to fix that first. Yeah. Oh, hang up. Okay, I'm gonna hang up, sorry.
Okay, can you hear me?
Zoom is fine.
Zoom is fine, yes. I'm speaking. I think they're still having a hard time hearing us on the Zoom. Whoever is on the Zoom, we can hear each other, obviously, but people in person are not able to hear us. Brad? Oh, so you can hear me? Okay, perfect. So I can start? All right. Sorry about that. Thank you for your patience. And once again, thank you for having us with you in Western Massachusetts. I really wanted to be there in person, but it's a very long drive. It's 2.5 hours back and forth. So I'm grateful that I have the opportunity to speak to you, even though we're not together in the same place. Thank you, MAPA. Thank you, Western Massachusetts, Healthcare Workers for Palestine, River Valley for Health in Gaza. And thank you for the previous speakers, Dr. Wiedner and Hiba. I really appreciated listening to them and hearing about the work that they have done in Gaza. And I would like to share some slides with all of you. Can you see my slides? No, that's not what I wanted to share. Okay. Do you see the slide that says Day 17, Destruction of Healthcare in Gaza?
Yes.
May 17. Okay, perfect. All right. So unfortunately, we are in a situation where we continue to talk about the same topic, which is the destruction of Gaza and the destruction of the health infrastructure and the livelihood of our people in Gaza. And I long for the day when we can start talking about rebuilding and rehabilitation of the people and the hospitals and especially the children. For that, we need to continue working, and we need to continue speaking, and we need to continue doing these meetings and talking to each other. My name is Karameh Kuemmerle. I'm a Palestinian American. Actually, my family is from Palestine. All of them live in a city called Nablus. This is my family's house. It's on the steep mountain called Jabal Jarzim, and in order to get to my parents' house, we have to climb 72 steps. This is a sign that has my name and my father's name, who's also a medical doctor. So my connection to Palestine is very personal, and what is happening affects me on a human level and a personal level and a family level. And I want to just, talk about some of the work that we are doing here in the US. Unfortunately, I was not able to go to Gaza, even though I applied to go very early on by virtue of being Palestinian. We are denied the right to serve our people in Gaza because of the draconian measures that the Israeli COGAT, or whatever they call it, inflicts on Palestinians in all of Palestine, even those in the diaspora. I wanted to put the UN Charter for the Rights of Children for us here to see, and for us to understand how every single one of these items has been violated in Gaza and violated in Palestine at large. The Palestinian children are now having no right to live, because at any time a bomb can kill 50, 40, 60 of them, as we have been seeing even in the past few days. I think the number is 50 children in the past 48 hours have been murdered by Israeli attacks. The right not to be separated from their parents. Unfortunately, we are seeing so many orphans because their parents have been killed. We have seen children being abused because of displacement, lack of food, and starvation. They are, it's just, some of these rights apply to other children, but even in Gaza, the right for being protected from any of these things is completely removed by virtue of the complete destruction of the infrastructure of the society. Dr. Wiedner shared a very comprehensive review of how life in Gaza right now is. So I will share a very personal anecdote, and I will move to speak about what is happening here in the United States in the medical community. So I have been trying to work with the people in Gaza by doing virtual visits through an organization called Gaza Health. And this has been a very difficult situation. First of all, the internet connection is extremely difficult to achieve. The ability to give valid medical advice or medical intervention is absolutely limited by the fact that there are no medications, no water, and no food to give to recommend a certain diet or a certain level of hydration. That is not even possible. These are little girls from Khan Yunis, Sarah and Zaina. Mom gave me permission to use their pictures. They're healthy. This is their new apartments that has been bombed. They were retrieved from under the rubble. Both of them sustained traumatic brain injury with raccoon eyes. As you can see, this little girl has raccoon eyes, which indicates a fracture of the base of the skull and intracranial hemorrhage. And they are never the same since then. And their parents are not able to provide for them the rehabilitation care that they deserve. One of them is in Egypt with her father. One of them remained in Gaza with her mother. And I actually lost touch with the family, and I don't know what happened to them. They have been displaced at least 6, 7 times the last time I spoke to them. This is the most updated statistics from Euromed that has been giving us a lot of information about Gaza, the destruction in Gaza. Just to make it clear here, the numbers that we cite are the numbers from the Ministry of Health records. And speaking to the doctors in Gaza, the doctors, the hospitals are very careful in reporting casualties. They only report casualties that they know the identity of. So they take a name and an age and a date of birth, and that is how they report casualties. A lot of bodies are unidentified or have not been retrieved from under the rubble. A lot of people have died in their tents or died in their homes that have been destroyed, and these are not accounted for. There's also a lot of people who have chronic diseases like kidney diseases, chronic renal failure. 40% of patients who receive dialysis have died because there is no dialysis and no hydration. Patients who have cardiac diseases and who suffer from heart attacks have died without intervention, and a lot of them died in their tents or in their shelters and have not been brought to a hospital. These are not accounted for, so the numbers are multiple folds higher than what we know. And I don't think we will ever know the real number until there is a massive effort to record who is missing and who is taking information from the families themselves. So an estimate by the Lancet is 180,000 people have been killed, but there are also higher estimates that put the number of people killed close to 400,000, which is an astounding number for a small community, a relatively small community that lives on a small area. So everybody has lost at least one or two or three members of their own family, and full families have been wiped out where the bloodline has completely disappeared. This is what Gaza looked like actually in November, when there was in January, when there was some buildings that were standing, and we are seeing more and more pictures where all the buildings have been wiped out, and mostly a lot of the areas look exactly like this, where everything is leveled down by orders from the Israeli governments, who are intent on flattening Gaza in their attempt to complete this genocide. I always remember our colleagues in Gaza. This is Dr. Adnan al-Bursh, who is an orthopedic surgeon who was murdered and tortured to death, and he was raped in detention. He is a very, Allah yarhamo, he was an exceptional orthopedic surgeon, highly skilled, and the loss of doctors like him will take decades for the Gaza society to rebuild and bring back these talents into their communities. That brings me to Doctors Against Genocide, which is an integral part of what I have been doing since the genocide happened. And just just to give you an idea, and the reason why I want to talk about Doctors Against Genocide is because we want to talk about healthcare and the medical community in the United States. And I also want to share with you what triggered us to build this organization, and what is our mission, what are our goals, and how we can engage other people in the community together to hopefully reach a place where genocide, war crimes, and crimes against humanity are a thing of the past, and a thing that all of us collectively in the medical community and beyond take a united stand against, which is something that we have not seen in Gaza. So Doctors Against Genocide is a global health coalition, and that is committed to confronting and preventing genocide, war crimes, and crimes against humanity. The medical community is very divided on on how to approach international affairs or even affairs in the local communities. There is a lot of resistance to being engaged beyond what happens in the office and beyond what happens between the medical provider and the insurance company, or the medical provider and the patient that they see. And there is this strong push to limit the medical community to the rules and the regulation of, the reimbursement, the what the insurance tells you to do, what the hospital leadership tells you to do, and having a blind eye to what happens outside the borders of the hospital, which is something that is, in my opinion, limits the good that the medical community can do. In the United States alone, we spend at least 15% or 20% of the national budget on healthcare. A lot of people are employed in healthcare. We are a massive number of people who work together to make sure that everyone is healthy and taken care of. So we have a lot of influence, and we should be able to push for policies that protect us in home and protect people from our weapons that can destroy their communities, just like what we are seeing in Gaza. So part of the mission of Doctors Against Genocide is to educate the medical community, give us the tools, give us the language to how to advocate and how to speak, how to define these things, and how to find a role for us in advocacy, in addition to being very good doctors, very good nurses, and excellent researchers in our hospitals. We also have a responsibility collectively to protect our oath, to do no harm and protect life and hold life sacred, and protect the advances that humanity did with international laws and the laws that protect civilians, protect children. These frameworks are being demolished, and we need either a different framework to protect humanity, or we need to resuscitate them and make them stronger. And that is what we try to do every day together in the medical community that has found its voice to rise up against the crime of genocide. Genocide is a public health emergency and a public health catastrophe. And from what we have seen in Gaza, we know that destruction of the hospitals and destruction of the healthcare basically facilitates genocide and makes it so much faster. As I said, there are so many people who are dying because the hospitals have been completely destroyed and taken out of commission. The heart disease, the chronic kidney disease, the cancer patients, all these people are dying to the degree where life expectancy fell down by at least 30 years in Gaza, which is unbelievable when you think about it. So ultimately, genocide is a medical catastrophe and a medical emergency of the highest level. Part of our work to define, to actually think about how to think about genocide is we actually tried to, we submitted the definition of genocide to the United Nations. The medical definition of genocide is mostly is more focused on the urgency of intervention to protect life, as opposed to the legal definition, which is more focused on not the fast action, but more on basically waiting for the legal entities to collect evidence and to refute the evidence. And then there is a case in the International Court of Justice. And then, the opposing team will ask for delays. And we have seen that in the ICJ, which we all, we hold high. It's the highest court in the land. And still, the ICJ was not able to do anything or even come up with a conclusion because of the legal, how speed bumps that they're on the way. In the medical communities, we cannot afford to wait for a lawyer to tell us what this is. Once we see civilians being hurt, once we see there is a systematic destruction of a people based on on their identity, then it's our duty to speak up, and it's our duty to put pressure on policymakers to prevent this crime from continuing to happen. Genocide is preventable. Genocide has signs that people can actually recognize. And the reason why we founded Doctors Against Genocide is, as Palestinians, we actually started recognizing these signs slowly. We started seeing how there is extreme discrimination, extreme racism against Palestinians inside Palestine. We saw how, Palestinians are segregated into communities where they have checkpoints around us. There are roads for Palestinians and roads for the others, for the Israeli settlers. And we have seen pogroms happening. All the signs were present to make it so easy to predict a genocide of a massive scale. And it happened in the blink of an eye. And it needed a flame, which can be, what happened on October 7th was just an igniting flame for a genocide that has been building for decades. And it has also been a very easy way for the Israeli government to justify its actions, while its actions has preceded October by a long time. So forced displacement is also one of the public health symptoms of genocide. People who are displaced suffer from a whole number of different health difficulties that people who are always in their communities actually adjust and learn how to deal with their community, and they have coping strategies. Every time a population is placed, there is severe health difficulties of access, of mental and emotional stress. People who are displaced suffer from, and Dr. Wiedner will know this more than I do, suffer from psychosis, suffer from schizophrenia, suffer from mental health issues that are extreme. Children will have a lot of behavioral difficulties. So ultimately, it is very medical, and we, as a medical community, we need to address it as soon as possible. So our mission is to try to prevent by identifying the signs, expose the signs, and respond to genocide. We take a lot of care in documenting attacks on the health infrastructure. We have been, when it comes to Gaza, we actually try to speak to the doctors and the nurses and the people in Gaza themselves. And we have constant communication with them, and we try to bring their voice to the outside world by inviting them every Sunday to our webinars so we can hear directly from them. We also want the medical students to learn about the stages of genocide and how to detect genocide and how to prevent genocide. And that's why we have many medical students working with us. We also defend the right of health workers to speak out so that we are not censored and silenced, which has been an extremely challenging thing. And we continue, a lot of our members and a lot of our allies continue to suffer from that. But our response to that is We have to continue to speak out. The more silencing that happens, the more we are steadfast in our right to speak up and our right to collectively stand on the right side of justice. I will share with you some pictures and some actions that we have been doing together. And, I think at the end there will be some questions, so I'm happy to answer any questions. So we held the first conference on the medical perspective on genocide in Michigan in 2024. I myself spoke in the United Nations to speak about the medical definition of genocide and about the duty of the medical community to speak up against the atrocities in Gaza. A lot of you who are listening have know us in person, know I think Dr. Jbour, who is also the co-founder of Doctors Against Genocide, is also on the call. Maybe he left. He's working. Oh, he's here. So we also have monthly visits to the Hill, where we actually encourage medical professionals to join us. What we do is we actually exercise our civic duty of speaking out and exerting pressure on policymakers by asking for meetings with the representatives, the senators, the congressmen. And what we do is we educate on the first part. We actually have a leave-in paper that has updated information and updated asks on what we want the medical community, what we want the representatives to do to help us protect life and to help us achieve our mission. These days on the Hill, even though they are very frustrating because our politicians are complicit as in an unbelievable way, it is a way for us to be present, to do our duty of speaking out, also to connect with each other and organize. And since we have started, actually our community have grown in a very organic way, where we started knowing each other all over the country and all over the world, and build the strong medical community that is brave, and that is committed to human rights and committed to being humanitarian, regardless of religion, ethnicity, background, politics. We go by the motto that never again should be never again for everyone. We also hold press conferences. Sometimes the security chases us and we have this conversation with them, but all we want is education. We want the people in the Senate and the Congress to know that we are there watching them as the medical community. And we also want our peers to get inspired and do more. We have an exhibit called Genocide in Palestine that we have hosted in several places in the United States, and we will be happy to host it again. And we like to participate in different events with the goal to educate, to build the community, and to work together. This is one of our medical students, Mary Beth, and we are really proud of our medical students who we got to know. They are our most enthusiastic members and very strong speakers and very strong advocates. This is another event that we did last year. And we also went to the United Nations, and we have connections with the Special Rapporteur on the right to health, and different rapporteurs in the United Nations who can be very helpful. But as always, the United Nations needs the governments to work. So connecting with the United Nations is very useful if we use these connections to actually pressure policymakers in our own governments and change the policy by constant pressure. we submitted the medical definition of genocide to the United Nations Special Rapporteur for the Right to Health in January, which also had a section on the genocide enablement apparatus in Gaza and abroad. The genocide enablement apparatus is Dr. Abu Sitta framework of describing how the medical community continues to be silent, continues to silence and censor, and continues to put the interests of donors and the interest of special entities over being just and being right and being humane. And that is a real shame. And I still have hope that we together will continue to put pressure and make this make a significant change. And I think Gaza has exposed the cracks in the medical system, and it will continue to expose the crack. I just hope that we will all survive this and we will start to build and rebuild once again. More photos, more meetings in the Senate. This is Roxana, one of our members. This is us in the United Nations where we were there for our meetings. We have a campaign called Bread Not Bombs. And I encourage you to go to our website and encourage you to go to our Instagram. This is a very simple campaign where we actually took bread from a restaurant in Gaza, in DC, that bakes Palestinian pita bread. It's a Palestinian restaurant. The owner is Ghazawi. And we took the bread with us to the Senate and we gave the bread to the offices, asking them to actually push for aid. There was a lot of interest in this, and I think we need to capture media attention. That is part of our work. And in order for media to pay attention, sometimes you really need a catchy story or a catchy phrase. They might seem a little childish or not very, kind of simple, but simple, catchy phrases can get media. We need the media that also is complicit to cover what is happening in Gaza. So we continue to try and we continue to build these connections. And this is part of, we did this in the Senate, heart building, and we were there saying bread, not bombs, let the children eat. And there was a lot of people who heard us. And I think this is an action that we all should be doing in our different communities to get attention to what is happening in terms of the starvation in Gaza. And ultimately, we do not have an army of that can make things happen and let aid in. We, as a medical community, we need to continue to put pressure on everyone who can actually make a difference. And by shaming, by media, by visiting their offices, by writing op-eds, by organizing more in the medical community, my message to every one of you, please organize and please work together and let us be a community of upstanders in front of genocide and not bystanders who just watch it happen and as if it is none of our business, because ultimately this is our business. We are paying for it. Our politicians are paying for it. And we are complicit, and therefore we need to speak up and change the reality. And thank you so much. If you have any questions, please put them in the chat. I saw a question that was
Now back to us.
And we're back. So now is the time for questions and answers. And first, I'd like to ask if there are any people on the Zoom call who have put questions in the chat or in the Q&A. And if they haven't, but they have questions, put them in the chat or the Q&A so that we can address them to our speakers. And yes, I would ask our speakers to come back. And then I would ask that if someone here has questions, if they could come here so that the people on the Zoom call can hear your questions. And are there any questions? Well,
Zoom first.
but
Margaret, Margaret,
if there's none on Zoom, then we'll go to the folks here.
That is the beauty of a hybrid.
Yes.
About doing a hybrid Zoom is that now that we're back doing the live is the main thing. We just gotta kind of flip-flop everything back. But
Yep.
we'll get it all set up. Just give me 30 seconds.
And you are so lucky that I'm not doing the technology. Okay? Just let's leave it at that.
Can I just say, well, Kuemmerle does that? Dr. Kuemmerle just talked about bread, not bombs, so we do have the QR code right here, so everyone can do this petition. So feel free, afterwards to come forward, like John just did.
Yeah. And there are also some handouts and information from the various speakers and also from River Valley for Gaza Healthcare that are exemplars of things that we had handed out and the letters we wrote, but you'll learn about that later. So anybody from Zoom?
Just talk for 5 more seconds.
Oh, 5 more seconds.
Right, you guys.
You got a question?
Okay.
Oh, I see.
Yes, I can actually do the Zoom questions. Just give me a second.
Okay. So where are people from? Are you all from the Northampton, East Hampton, Hartford?
Some of the handouts there are for anyone who are interested in participating in either solidarity tours or medical missions. There's 4 printouts over there. There's not a lot of copies. You can take pictures or you can leave your email address and you can email them to them directly. A lot of good options.
And there's still refreshments. Yeah, gotta eat those donuts. And drink that coffee
All y'all on.
and go to that bathroom.
We'll give you another minute to type in your questions. How many questions do we have time for?
How about let's just start with one question.
Okay, let's see. Well, let me just change my video. Okay. Let's see. I'm just gonna pick one down here on the list. All right, this one comes from Lisa. What type of organizing and actions do you think are the priority to end this genocide?
Yeah. We're deferring to Dr. Karameh on that.
okay,
We're deferring to you, Dr. K.
okay,
Wait, hold on. Oh, this one, you would have to switch. We would be switching back and forth because of the Zoom thing.
Yeah.
So, would you like to do a different question? We can save all the ones for.
Okay. We're gonna have to save all the ones for Dr. K because of the technical difficulties of
Yes, because-
sound, but if there are other questions for the other speakers,
Yes, you want to do another one instead?
if there, yeah,
Let's see.
I think we're all very concerned about what can we do.
Let's see. Here's another one. I am curious if you have connections with the UN enough to get speaking time to the UNSC like Ray McGovern, Aaron Mate, And next Blumenthal.
Also Dr. K.
Also Dr. K.
Also Dr. K.
Yeah. Because she's our American, well, United Statesian perspective.
There is a call bank group in Connecticut where I don't know about Massachusetts. There's probably one in Massachusetts as well, where like every single day we're asked to call our senators and Congress folks, and we're given a script, and we're often given other messages and people to call. So as far as Senator Blumenthal, I regularly call and leave messages and email, and sometimes you get a letter back, and from him in particular, it's not a letter that you know, it just kind of makes your blood boil. But you can still participate. So I would encourage people to maybe find your state phone bank group.
Okay, thank you. I don't know that Massachusetts has a particular thing, but I know that there is a woman named Kathleen Temple.
We're saying yes, they do. She says yes.
Oh, yes, we do.
Have one in every state, but I'm not entirely sure, but I believe to have one in every state.
Okay, believe they have one in every state, but we don't know the connections. There is a woman named Kathleen Temple who publishes Peace Bits every day that you can subscribe to. And she gives suggestions for calling representatives and senators' offices. Okay. Okay, question from the audience? Okay.
With children who are amputated, how often do they need to have new prosthetics because they're growing?
So that was one of the difficult things for us. We didn't
Mute
get to
yourself.
encounter little children that need prosthetics, but we did ask this question. So the companies that we were with, either Auto Care or the Prosthetics Motion Solutions, they do have a different plan for children as well. So as they're growing, they're readjusting, they're refitting those legs. So it's, I think from a year-to-year basis, they're remeasuring just to make sure that if there's any adjustments that needs to be taken into account, that it's done. Yeah, so that was definitely one of the questions I had right off the bat, to make sure that they're getting that prosthetic that they need in order to live their life as a child. So, yeah.
Anyone else in-house have a, come on up. Yeah, John left. So. Well, yeah, because we need the Zoom folks to hear you.
Okay, I think I have two things to ask. The first thing is that as an elder, my heart feels really distraught because I feel so helpless. I don't know what I can do for Gaza. I'm on Social Security. I don't have much money. So I guess my one question is, what can I, as an elder who has very little resources, but has a desire to want to help the Palestinians in Gaza? The second thing I want to ask is that I've been trying to educate myself because I didn't realize how horrible my own government was. I thought I was so aware of different things with our government in the United States. And I was so distraught at when I found out that they were sending the weapons that were killing the Palestinians. And as I was watching Google and I saw Code Pink going to different representatives and asking them questions, and the insensitivity and the coldness of their reaction, not response, how they were to the Code Pink activists. And so I wondered, I appreciate all the work that the people here are doing and the speakers. They have a lot of courage and a lot of compassion, a lot of love. And I wonder, as they try to educate our representatives, are there just some people, even if they are educated, that they just don't care? And what do you do about people like that? So those are my two questions.
Anybody? I know. She has the answers.
Let's see, you know what?
But you know what? Let me just say, well, did,
The first question, first of all, thank you for your questions, but I'm sure Dr. K will have much better answers than me. Yeah, what do you do if you don't have a monetary way to support? But there's so many other ways to support, but you have to feel comfortable, right? Like you could join a protest or make phone calls or ask to meet with your local representatives. I don't know how to respond to the question of what do you do when you try to educate and people don't care. It is, I have had trouble making sense of how upside down the world seems right now. Like what's the problem? Why is there such a problem in understanding what is going on? I don't have an answer. I don't know. But the moral distress that we're all feeling is profound. But education, I think, is key.
I would say I love the Doctors Against Genocide webinars every week, and if you can register for them and listen in on them, they're very helpful. I'll also say for the Massachusetts people, contacting the Commission on Anti-Semitism and insisting that they stop conflating speaking against what Israel as a government is doing with anti-Semitism. I think that's so important. And that's my bit. And I think now we're going to our video speaker. And thank you for your patience, everybody, once again.
So I can speak.
Yes, let's see if this works.
Can you hear me?
Fire it away up here and I'll hear you.
We can hear her.
Everybody can hear over there?
Yeah.
And then,
Okay, so for the speaker who just came and shared her distress about what to do and seeing the Code Pink videos and how cold the people in the videos are, this is like a perfect pitch for an op-ed about how, I really encourage you to write this and submit it to the local newspaper, because this is a story that many people are feeling, and it's just very powerful. Another way, I really think media is an underused tool that we have, and it is not just the protests that we want them to cover, it's also how people are feeling collectively. So, if you belong to a church, if you belong to a synagogue, or if you belong to a mosque, find people and who care about this together with you and say, we are a group of 10 people and we have been experiencing this distress because of what our government is supporting overseas, and we see these children being obliterated, and put a press release send a press release and say today, or do a bread not bombs stand in front of your mosque, in front of your school, and put a press release and ask them if you need help with that. We put a lot of tools on the website for Doctors Against Genocide because we realize how sometimes you just don't know what to do. And simple things like 5 people doing bread not bombs, 5 people doing not another child, not another hospital stand, 1 person who loves writing to an op-ed to the local newspaper, doesn't have to be the Boston Globe. In Western Massachusetts, River Valley for Health in Gaza is a very active group as well. And I think the phone calls are very, very important. And they help us a lot when we go and visit these offices because, the staff will say, yes, a lot of people are calling. It makes a big difference. Petitions and letters also make a big difference because, for example, this one that I posted here, not another, let the children eat, bread, not bombs. We will actually take the numbers of the people who signed and we go office by office and say your constituents want you to make a statement to let food in and the starvation and end supplying deadly weapons to Israel because Israel is killing children. This is what we need to say, and we need to say it over and over again. It's a big culture against this because, of the Zionist influence and how they link everything to anti-Semitism. But there is nothing anti-Semitic about saying stop starving children or end killing children. Do not make Gaza the graveyard for children. Gaza has the biggest number of amputated children in the whole world. Is that a Jewish value? It's like if you say that and people say you're anti-Semitic, it's like, it's logic 101. Are you saying that the right to maim children is a Jewish value? So it's not. So it's, we really need to put the words where they belong. And anti-Semitism does not belong in our speech about Gaza or Palestine at all. There, I think linking the Jewish faith to what is happening in Gaza is the anti-Semitic part, not talking about Israel and what it's doing. So, there's a lot of ways to do that. We one point that I want to say is that we do the webinars every week, and we want people to use the webinars to actually get educated from the people in Gaza. We bring people from Gaza. We don't talk about them. We don't bring an expert speaker to speak about Gaza. We bring the head of Al-Shifa Hospital to talk to us about Gaza, or Al-Nasser Hospital to talk to us about Gaza, or a teacher from Gaza to talk to us about the schools in Gaza. So we really want to center the voices of the people themselves and not bring somebody to speak about them. And one other point that I wanted to say, yes, organize, join us. We need all the help. We are a medical organization, so we have, our people are medical professionals, but we also have allies who help us spread the word, who help us talk, and who help us in press releases and press conference. So we just need to organize. Everyone needs to be organized. The right wing is very organized. The other groups that support the genocide are extremely organized, and we need to keep up with them. Thank you.
Here for the audience.
What do you want to get? Oh, so you don't have to.
Yes, go ahead.
Okay, so I
Right
have
to
a
the mic.
All right, So I have a question for, well, both of you here and also Dr. Cave, she can answer. You talked about the lack of medical supplies like drugs for, in the Gaza hospital. Is there a way for us to contribute to that effort to be able to stock those shelves and everything? So that is my first question. And then to you, you had mentioned, Heba, about people trying to leave. But that being very costly, is there again another platform that we could use to donate theirs to allow people, the ones who want to leave, to be able to leave? Also just one last question about the people who are going into Egypt. Are they being covered by UNHCR or is it still UNRWA that sort of takes the caseload?
So in terms of leaving, that's a very tricky situation. A lot of companies, you don't know which company is reliable and which company will be true to their word. So again, a lot of it is money. They're all money hungry to some degree. So for example, from my family, they used Yahala to leave, but there was, forgot the name of the company that they were previously using. So at that previous company, had charged them double and, didn't give them any results. They told them, oh, tomorrow, the next day. So there was a lot of back and forth with them. Thank God they didn't give them the money or else they would have just taken it and they wouldn't have heard anything. Again, $5,000 per person. If there's 10 or 15 that are trying to leave, very costly. In terms of, it's a very difficult situation. Again, now no one can leave. It's hard for anyone to leave at all. In terms of supporting those people or those are companies that are supporting people leaving. We've had this discussion amongst ourselves as a nonprofit organization. Do we want to support people to be able to leave? It's a very hard thing for us to focus on, if we were to do that, how can we say, oh, this family is worth leaving, they have the right to leave over this family. We can't really make that decision. It's hard as an organization. We've had so many people through Instagram reach out to us. Oh, can you help us? Can you help us? Again, we're not that big of a nonprofit organization. We're going to try to reach that goal, but we're still fresh and new. So the donations that are coming in, they're not going to be able to help support and get a large majority of those families out, maybe 20 or 30 people. But again, how can we decide, oh, this person's worth saving or worth getting them out of Gaza? So I forgot the second question, sorry. The supporting, UNRWA is a big player, but also donations from nonprofit organizations. So that's, we were going around asking to see if they were receiving anything. A lot of them are from small little little nonprofits. Another big thing is, a lot of people will travel to Egypt, and kind of distribute cash as another form as well. So that, again, it's just depending on who to get that money across the border. So it's a little difficult to kind of say, yeah, it's the supply is coming from this one person or from this one organization. But UNRWA is helping. The Palestinian embassy is also helping. They have some money reserved for situations like this, of course. So they are helping getting people out that are in dire need of if there's a critical medical case that needs to be addressed or taken care of urgently, they're able to help facilitate that move and get help medical wise.
I'd like to add that when my trip got canceled in February, I ended up going to Egypt instead. There's an incredible grassroots people helping the refugees in Egypt. It's really, really phenomenal. So I saw firsthand, I actually went around with someone who was meeting families and doing assessments and and then providing money for rent and starting businesses, all kinds of things. Network for Palestine is an excellent organization. It has, I think it definitely has a U.S. charity that is somehow connected to it, so that if it's too hard to get money directly to Network for Palestine, you can go on there onto Instagram and get the kind of parent company in the US that you can donate to. Also, the Samir Project is also, I would say, a very, it's legit, you know, like I can tell you Network for Palestine and Samir Project are legit. And if you want more, I could definitely give you more offline.
What's the latest on Dr. Osama?
I want to go off the mic and say that? Okay.
Does anybody have the latest info on Dr. Hussama Abu Safia of Al Shifa Hospital?
Yes, I do have an update. Can you hear me?
Yep.
So he is still detained. We heard from his lawyer, who is also a Palestinian with an Israeli citizenship, and she met with him. He has been beaten, his ribs have been broken, his eye has been injured, and he had a head injury from torture. And he lost over 30 kilograms, which is almost like 60 pounds, a little over 60 pounds. So he is still detained despite a lot of people calling for his release. He is still there. They have no charge against him. And he was nominated for the Nobel Prize. He knows that he is nominated. He knows that a lot of people care about him. Unfortunately, he says, don't give me the prize, just put pressure to release me. And unfortunately, these inhumane monsters are just, you know, you cannot reason with them. So these are the updates. He's still in prison. I would say he's not. He's being held a hostage. If we want to use the right words.
Yeah, let's see. Any other Zoom?
Oh, in the very beginning, there was a Zoom question for Dr. K that we held for her.
That's right. Well, let's see. I believe it was.
Is that the question from Karen?
It was. Ooh, that one came really early in the earlier in the event. Let's see.
Oh, UN, something about a UN.
Something about the UN.
UN Security Council.
Ah, yes. Here we go. So let's see. Yeah.
So yes, so you know, I think we should try to bring the voices of Palestinians to the UN Security Council as much as possible. So we will continue to do that. And you know, the repertoires can be helpful with that. So we continue to work with them and hope to just keep this topic alive and happening constantly. And I can answer Karen's question if that's okay.
You wanted just to have the exact question just read again?
Yes.
Yeah. Okay.
Go ahead.
So let's see. This one, I'm gonna find the one from Karen. Let's see. There is one about the UN that I read a little bit of a while ago. I'm not sure if this is from the same person, but let me know if this is the right one. I am curious if you have connections with the UN enough to get speaking time to the UNSC, like Ray McGovern, Aaron Mate, and Max Blumenthal.
Yes, so my answer is that we have some connections, and our priority would be to bring the doctors from Palestine to speak, because we are a medical organization. So this will be our focus. So we would be pushing for having somebody like Dr. Abu Rish or Dr. Abu Samia from Al Shifa Hospital or from Al Nasser Hospital to speak.
See what other questions we have in the Zoom. This one comes from Julie. There will be many protests in the US on June 14th. This is now called No King's Day. Will your panelists be taking part in protests that day that call for the end of genocide in Gaza? There'll probably be good media coverage.
That's good to know. I'll keep an eye for it.
There's so many of them. I think there's also, I'm in a group, and I'm not sure how legitimate it is, but I'm in a group of people who are supposed to march to the Rafah border. Are you in that one? Yeah, so can you imagine that? Thousands of people marching to the Rafah border? That would be incredible. So yeah, there's a lot of different days of this and days of that. Boycotting, that was the other thing. As far as action, man, hit them in their wallet, right? Hopefully everybody knows how to access the boycott list or the BDS movement list. Anything you want to go and buy, find out first if that company's on the boycott list. No thanks. Anything Apple as well. I mean, it's hard, you have to do your best. But there's some really easy ones like Starbucks and McDonald's. No.
This was the one from really early on. This was asked by Karen. This one is kind of a paragraph. So ready? On May 5th, Doctors Against Genocide presented live stream on the current catastrophic healthcare situation via doctors on the front lines. As follow-up, and there's going to be 4 points. 1, at that time, only 3 days of fuel supply remained, and it was being held in the red zone. What is the current situation, and how is that impacting mental and physical health care? 2, can you update as to evacuation orders and their implications? 3, is aid getting through? 4, how is the global campaign to protect children that Doctors Against Genocide launched that week going?
Okay. Tomorrow we will have another group of doctors join us in our webinar at noon, and we will hear from them exactly what is happening with the fuel. There has been nothing reaching Gaza, so I am sure they are working at the bare minimum. There are no medications. 80% of the medications have been gone, and the lack of medication is extremely severe. Even the doctors are actually hungry. They are living on a meal that probably has 300 calories every day, and they are slowed down. They drag themselves through their work day. So it is really apocalyptic, and it's just it's very difficult to imagine because all the aid is right there, few miles away from Gaza. In addition, the Israelis have intensified the bombing over the past few days. So this is absolutely inhumane, absolutely apocalyptic. People in Gaza are hoping for Judgment Day, basically. That's what they're like praying for. They're praying for an end. The evacuation orders, extremely difficult, extremely horrific, and it's all under the tight control of COGAT, and they are very haphazard. And there are like 10,000 people who need to be evacuated. They probably evacuate one every 3 days or something like that, with a lot of massive pressure. So it's very difficult. Hiba knows, and we all know how impossible it is to evacuate people. Aid is not getting through. The global campaign to protect children, we really want it to be a campaign that is sponsored by one of the senators and one of the Congress and the representatives, and we will continue to push on it. We have some leads. We are going next week to the Senate and the Congress. We are hoping for a meeting with one Republican and one Democrat together. We're hoping the staffers will meet together so that we can actually have them sponsor a resolution to protect children. So wish us luck. These things are very difficult. They need a lot of coordination, a lot of political will, and a lot of pressure, and a lot of people that keep going, and powerful voices. And there is power in numbers, and there is power in the medical community.
I can add a little bit. It helped me remember. The one is about food and one is about forced displacement. So if I ask you, what's the second one? Regarding food, so it's just been so, the outpouring of money and donations, has really been extraordinary. And, so from the people that I met there, I've been able to send money. And so I don't know where things are coming from, but there are some vegetables there, for example. Like I'll communicate with the person there and they'll say, Deborah, let's not distribute anything this week because I heard vegetables are coming next week. Prices are too high today, so let's wait till next week. So but it's just not much. It's just so little. And flour, the flour has gone off, and so they're starting to mix it with other things, and I forgot the other point, but the other point was about displacement, but there was something else. In one of my pictures, I showed like a couple of cans and some macaroni. Remember that? In order to get onto the list for someone to bring that box of food to you, you have to have had no food for 3 days. So, I mean, that's just like the situation. As far as forced displacement, I can't confirm the way it is right this moment, but the Gaza is divided up into blocks by Israel, tiny block, like a couple hundred blocks at least. So little micro neighborhoods, so they'll drop leaflets and say block 81, 93, 47, 100, you have 10 minutes to move. We're going to bomb, because this is all, their excuse is, well, Hamas is there. So civilians get out right away because we're going to bomb. So you can only imagine what it's like to pack up and move so many times. I'll repeat it for you if you say it. You're very careful when you mention Hamas because you were verbally assaulted on the bus. Keep going. If Hamas wasn't there, protecting the Palestinians, who else would be? Who's the terrorist? I don't have an answer for that. One day, I can't tell you a story. I mean, it's not an answer, but when I was there, and there were various occasions where we would get in a car or a Jeep or something and go maybe to a UN meeting or Ministry of Health meeting, maybe not UN, Ministry of Health meeting. And so we'd be traveling the main road, along the kind of along the beach, if you will, where the huge encampment was, Al Mawasi. And you'd get stuck in traffic, for lack of a better word, cars, donkeys, wagons, all kinds of things. And so sometimes you would just be stuck like next to another traveler and talking through the window. And I would have to have somebody translate for me because I don't speak Arabic. But I remember one guy saying, it wouldn't be like this if Hamas was still in charge. I remember being very struck by that, like kind of, saying they were good. They gave us order and protection, like you said. I guess it depends. I don't know. I didn't interview a bunch of people to ask them, how do you feel about Hamas? So I just that one anecdotal story.
When it comes to Hamas, it's very, at least from what I've been hearing with family in and out of Gaza, it's a very mixed perspective. So, you have some people are like, yes, they were protecting us, they were doing us good, and then now with everything that's going on, no, it shouldn't have happened. The number of casualties and the devastation that's just struck Gaza is just, it's unbearable. And we're on the outside looking at it, but the people that are in there are living it. That's just one thing that I guess I know I see a lot of people, yes, what they're doing is good and everything. They're revolting, they're trying to take back what's theirs. Yes, I agree on that aspect, but also you have to think of all the devastation, destruction that's happened because of that. And I get it. There's no in every war, if they want to call it a war, there's going to be some casualties, but when is enough enough? So.
I think at this point, we're gonna have Anne come on up and make an announcement.
Hi, everyone. Yes, I just wanted to give an announcement that the Massachusetts Peace Action and their partners have organized a vigil at the Harvard commencement. So for anyone who's in the Boston area who wants to participate in that, it's on May 29th, starting at 7 a.m. They will be gathering in front of the main Harvard Red Line entrance. And you can probably also go to MAPA's Massachusetts Peace Action's website on their events calendar if you want to get more information for that. Second, for anyone interested in in-person or online events in New England, throughout the Mid-Atlantic, down to DC, the New England Network for Justice for Palestine, NENJP calendar, gives daily updates. It's usually just the day before the events, so it's last minute, but still, you can sign up for alerts and participate either in your local community, if it's come up, or online from anywhere on in the world. And then lastly, for those online who didn't hear about the possibility or to get information on either participating in solidarity tours or medical tours, we do have information that we can email to you, and Tony Ann will pop Margaret's email address into the chat. Email her, say, yes, I would like that information, and we will email you PDFs of those lists. And you can take a look and see if you might want to go there. There's nothing more important. I was privileged enough to be able to go to the West Bank in East Jerusalem and the Golan Heights in 2019, and to see it in real life is very important. And to meet Palestinians on the ground and talk to them is very important. And of course, the medical missions are hugely important right now, not just in Gaza, which is obviously the priority, but also in the West Bank, where it has become Gaza-fied in the last year and a half. It's just horrendous. And also, I just want to say thank you to Margaret, because she's the prime organizer for this event, and she's just done an amazing, amazing job. Thank you. And thank you all for coming.
Let me just quickly jump up here, give a quick intro to Jean. She's going to talk briefly about the fabulous work that River Valley for Gaza Healthcare has been doing, particularly in regards to the silence of the River Valley hospitals. So with having said that, Jean.
Yet again, you gotta listen to me. River Valley for Gaza Healthcare really grew out of two people, two nurses, myself from Leahy Fast for Palestine, and Dodie from Demilitarized Western Mass. And we had a particular interest in addressing the destruction of the healthcare system, which we talked about today. and getting our local hospital leaders to call for a ceasefire and show solidarity with their healthcare colleagues in Gaza. We discussed it with our different groups, and we formed River Valley for Gaza Healthcare, which would be specific about healthcare issues. We drafted and sent letters to the CEO, CMO, CNOs of the 5 hospitals in the Valley, Cooley Dickinson here in town, Holyoke Medical Center, Bay State Medical Center in Springfield, Bay State Franklin in Greenfield, Bay State Noble in Westfield, and Mercy Medical Center in Greenfield. And most of the leadership did not respond to our letters, nor our calls, even after several follow-ups. And one of them, admin told me, he won't be interested in that. Basically, stop calling. So we demonstrated, leafleted, held press conferences at each of the hospitals, still no response. One of our members discovered that James Teclet, the CEO of Lockheed Martin, is on the Mass General Brigham Board of Directors, and that's one of the largest purveyors of military wear to Israel. And Cooley is an affiliate of MGB. So together with DAG and MAPA, we held simultaneous press conferences in Boston and here, calling out against this, calling for his removal from the board, for ethical investment policies, and free speech for their employees. Again, no response. So in the meantime, we've talked to our representatives, and some of them sat in with the Northampton representative for 3 days at his office. And so we're sponsoring a fundraiser concert for the children of Gaza on June 14th, and there are some flyers there, right next door in Pulaski Park. And then we're in a process of what is our next steps. So it's like progress. Have we made progress? Well, we made the paper a couple of times. We've had letters, we've had op-eds, but progress, I don't know. But sometimes I think you just have to, what do they say, throw your bread on the water and see what happens. So, we should all become more active, sign the petition, speak out, write to your representatives. The third age, which I consider most of us here to be in, I think we gotta slow down on the physical activity and work more on the writing and the reaching out. And that's fine, right? We do what we can from where we are. Thank you all for holding in on for so long. And Mirit, I think, has a few words to say to us also.
I might have to sit down because of the awkwardness of this angle.
All right. All right, so hi everyone. So I wasn't actually planning initially to speak today, but this is a little bit last minute. I wanted to speak about the starvation campaign in Gaza. And I wanted to start by posing this question. So if God forbid, 66,000 children in Boston, that's about 65% of the children in Boston, were facing severe malnutrition, how would the public react? How would the president react, the US government, the international community? On May 6th, UNRWA reported that 66,000 children in Gaza now suffer from severe malnutrition because of Israel's blockade of food and aid, which has been zero, nothing is entering since March 2nd. So remember how wanted war criminal Yoav Gallant said there will be no electricity, no food, no fuel going into Gaza? Well, since early March, that's exactly what's been happening. completely blocked all aid as opposed to much of the aid or most of the aid. And when Trump went directly to Hamas and got the Israeli-American Israeli occupation soldier release, the plan was actually the next day the blockade would end. There would be aid coming in, and there would be an immediate ceasefire, basically. That didn't happen, as you can tell. So the Integrated Food Security Phase Classification, the IPC initiative, said the Gaza Strip is facing a critical risk of famine, with the vast majority of the 2.1 million population at severe risk. The population is 2.1 to 2.3 million originally. And I just wanted to mention, this is an important point, that the Gaza Ministry of Health counted the death toll as a week ago was 52,862 Palestinians. Deaths by traumatic injury, direct bombardment. We know this is a major undercount. According to a Lancet article back in February, the deaths due to traumatic injury up until June 2024 were likely underreported by 41%, according to their analysis. 41%. Another recent paper in the Lancet stated that the life expectancy in Gaza has been decreased by 46.3%. That's nearly 50%. And now the average life expectancy has gone from 75.5 years down to 40.6 years, which is probably younger than most of the people watching this, or many of the people watching this. Comparatively, there are 11, so what are the lowest life expectancies across the globe, according to the WHO? There are 11 countries with between 50 and under 60 years of age, and none of them are under 50. Okay, so this is how bad it is. If we use the previous Lancet paper, conservative estimate of 4 indirect deaths to each direct death, we would estimate that 12% of the population would die or have died of Israel's genocide, even if a complete ceasefire and the entry of all aid started today. So that's 12 out of 100 people. So just imagine that. And what's it like for the people alive? Well, some of them are wishing for Judgment Day, just as Dr. Hawash said. I'm going to skip ahead and just let you know that the food prices in Gaza we could not afford. We were talking about the price of eggs recently. Well, imagine the price of bread. One loaf of bread went up to $90. Okay, so in Gaza it's gone up by 3,000%, and now it's $235 for 25 kilograms of wheat flour in Deir al-Balah, for example. A third of people, according to one report, said they were collecting garbage to sell for food, and a quarter said that no valuable garbage remains. Why is this happening? Because Israel has been systematically destroying civilian infrastructure and food sources in Gaza. So they destroyed Palestinians' ability to provide food for themselves. They damaged 75% of crop fields, nearly 80% of orchards. They killed 95% of cattle have been killed, for example, and some of them died of starvation. Okay, just the cattle, they weren't even eaten. 70% of water has been lost due to damaged water pipelines. And now Israel cut off power to the South Sea desalination plants and cut its capacity to produce clean drinking water by 85%. So most of the population is not getting enough water, basically. But aside from murdering at least 399 aid workers, including 289 from the UN, and over 1,400 healthcare workers, Israel has been actively destroying Gaza's ability to keep law and order. They've been launching assassination campaigns targeting the police force, the security forces, the defense forces, the healthcare system. We already spoke about the healthcare system, right? So Israel calls any civil servant in Gaza a Hamas operative and uses that as an excuse to target them. And we're not even going to start on the journalists, right? Mondo Weiss collected testimonies documenting Israel's targeting campaign and its sanctioning of looting and lawlessness to accelerate famine conditions in Gaza. They have evidence that Israel is not only actively fomenting, but possibly arming the gangs that loot the dwindling food resources, and they target and murder those who try to stop the robberies. Okay, Dropsite News compiled a thread of eyewitness reports and journalistic reports stating that many of these gangs are looting with Israeli supports from quadcopter drones, what Dr. Wiedner mentioned earlier. There are reports that are undercover Israeli operatives are pretending to be Palestinians in Gaza, except that they're arming the gangs. The timing of the robberies of these crimes is exactly in line with the appearance of the warplanes in the sky. We're not going to talk about the Flower Massacre. You probably remember that from last year. In December of 2024, the meeting of the UN General Assembly, 137 member states versus 12 sought the view of the International Court of Justice judge's advisory opinion on Israel's obligations as the occupying power in Gaza and the wider occupied Palestinian territories. Unfortunately, the court has no enforcement powers, but once the court has issued its opinion, it does carry legal weight, and the General Assembly can decide on further action. So they are, according to the hearings, which I think are still ongoing, not only is Israel an occupying force, but in that way, they have a clear obligation to not only allow, but facilitate humanitarian aid to Palestinians in Gaza, which is the opposite of what they're doing and the opposite of what they're openly calling for. They are openly violating international law before our eyes. This is a genocide before our eyes. I don't want to hear about it being called a war anymore. This is not a war. People's lives don't get halved. The life expectancy does not become half because of a war, generally speaking, for largely unarmed people, right? So UNRWA is the particular darling target of Israel because they support the right of Palestinian refugees to return, including the people that have been evacuated to Egypt with great difficulty. And so Israel has been actively targeting them. It said that it won't allow the entry of aid into Gaza until Hamas releases all the remaining captives. And yet Israel nearly killed the American-Israeli Edan Alexander. And in fact, a new investigation by Ynet, an Israeli news outlet, the government and Israeli military are fully aware that the army attacks have led to murdering the Israeli captives, that they're putting them at risk. And in fact, and I want you to hear this, one person with a senior position in Israeli intelligence stated his main task in intelligence was to save the hostages, not from the Palestinians, but from the Israelis' military operations. And according to Ynet, the return of captives has not been among their central military objectives since October 7, despite their claims, and the captives are likely starving alongside the Palestinians. So the WHO stated that while famine has not been declared, people are starving now, and nearly 71,000 children under the age of 5, not under the age of 18, but under the age of 5, are expected to be acutely malnourished over the next 11 months. This malnutrition will make it much harder to fight off infections, infections that maybe they could have fought if they had vaccines, which they're not getting, right? Pregnant and breastfeeding mothers are at high risk. So how do you account for acute malnutrition in this population with high numbers of amputees and where the average life expectancy is now 40.6 years as of several months ago? Now it's probably much lower. So the supplies that remain for the WHO in Gaza can only treat 500 children with acute malnutrition. It's a tiny proportion, but the WHO, the UN, and UNRWA's life-saving medical supplies and food and aid are literally sitting outside of Gaza, ready for deployment. They have the safeguards to make sure the aid gets into place in line with humanitarian principles, not in line with the black market. There are thousands of trucks loaded with food and supplies on the Egyptian side of Rafah. And somehow the international community seems unable, or more likely unwilling, to force Israel to allow the aid across Rafah. What about Israel's plan to channel aid through private contractors? The UN warns that it violates humanitarian principles. Specifically, it's pushing civilians into military zones and it's compromised aid. So if you hear of the Gaza Humanitarian Foundation, know that it's a Trojan horse, just like the pier, you know, where that they used to attack Palestinians and then that drifted off into the sea was a Trojan horse. So what can we do? You can start by supporting Doctors Against Genocide's Bread Not Bombs campaign. There are some efforts to push back against the blockade. Recently, Senator Van Hollen, along with a number of others, called on the U.S. Comptroller General Gene Dodaro to launch a Government Accountability Office investigation into the federal government's implementation and compliance to the American laws. Basically, you're not supposed to give aid to people that are violating international humanitarian laws, including the Leahy Law, which is supposed to ensure that none of our taxpayer dollars support foreign security that commit gross violations of human rights. And that's exactly what Israel is since its inception. So you can call to support that. You can call on your senators to co-sponsor SRES 224, introduced by Senator Walsh. It's titled A Resolution Calling for the Urgent Delivery of Humanitarian Aid to Address the Needs of Civilians in Gaza. A New Policy, which is a bipartisan advocacy group, issued a call for the public to encourage their senators to co-sponsor and thank those that already signed on. And we're going to share the link to that call to action. Peace Action nationally sent out a member of Congress blockade response tracker, so you can tell if your MLC responded to this issue at all. There's an organizational sign-on also for the unified call to confront famine in Gaza as of May 12. We will send you the link to the Google Doc. The demands are to call on all states to commit to dispatch official diplomatic missions to accompany the aid trucks into Gaza via Rafah. Reject the weaponization of aid and Israel's planned distribution scheme, and it is a scheme. Urge all states to coordinate with the UN and Egypt to facilitate immediate and safe passage of humanitarian aid, medical teams, relief workers. We are calling on individual diplomats, parliamentarians, ministers, everyone basically, to join the envoy to urge international media outlets to expose the blockade-starving Gaza. So this is something that you can do if you're retired, for example, or if you have money, if you have time but no money, you can, or if you have money but no time, you can always work to support this. You can pressure the media outlets and bug them, you know, call them repeatedly, email them repeatedly to expose these crimes. And you can also call local news stations and try to speak up. You know, when they allow you to call in, you can try to speak up about Gaza and, you know, make it something that's on everyone's mind every single day. They cannot get away from Gaza. You can try to pressure trade unions, NGOs, call on the UN to declare Gaza a famine zone based on verified data. You can also support the Freedom Flotilla that is still trying to break the illegal Israeli blockade. Their ship, the Conscience, was attacked in international waters with Israeli drones, but they're preparing a new vessel, the Medlin, to sail to Gaza in May. You can also join Code Pink. You can confront the government officials regarding the blockade. You can do what the co-founder of Ben & Jerry's ice cream brand, Ben Cohen, did on Wednesday when he confronted RFK Jr. for the lack of humanitarian aid into Gaza and got arrested for his efforts because, you know, red dye in foods is bad, but Palestinian blood, it's okay. That seems to be the attitude of our government, at least. So last but not least, I would like to encourage everyone to support organizations such as, and I'm going to pull them up. You already know about Mass Peace Action generally. I'm going to recommend a new policy, which is a strategic initiative to restructure political incentives on U.S. policy toward Israel-Palestine. They advocate to prevent the enactment of laws and policies that undermine American national interests. For example, making speaking up against Israel's crimes illegal. To stop them from limiting free speech and harm prospects for lasting peace, etc. There is Dawn, which is doing great work. They submitted a report to the International Court of Justice against Biden, Blinken, and Austin for their support of Israel's genocide. There's taxpayers against, and they're also supporting a report on Israeli torture of Palestinians. So please read up about it and please support them. There's Taxpayers Against Genocide that is taking Congress people to task for taking them to court for using our taxpayer dollars to support genocide. And now they've gone to, I forget if it was the ICC or the UN with one of their reports. There is also UNRWA, obviously, is one of the main ones. There's Palestine Legal for to support people that are protesting here in the US, especially students. And there's BDS, which we spoke up about, and the boycott is one of the things that they find most threatening. So definitely boycott, boycott, boycott. And for healthcare, there's the if you're in healthcare, you can get into the committee, and you're an intern or a resident, you can get into the committee of interns and residents groups that support Palestine. I think that's it for now. I overdid my time. Thank you. Okay. Thank you to everyone who survived this long as well.
So I wanted to thank everybody who's here and helped to give us more hope and faith. It's nice to know that I'm not alone, that there's all these wonderful people that are trying to make a change to make this a better world.
Thank you. We appreciate you too. Thank you.
All right, that's the end of our wonderful event here. We're so thankful to all of our speakers and to our audience. So there we go. Thank you.